Other facilities are understaffed and out of beds to attend to critically ill COVID-19 cases. Joining us for a conversation is Dr. Christian Owo. He's senior lecturer at the University of Ghana Medical School, head of ICU, Kolebut Teaching Hospital, and National Case Management Coordinating Member in charge of severe and critical COVID-19. Thank you so much for your time this afternoon, Doc. Where do we stand as far as our cases are concerned? Doctor, kindly unmute for me. Hello, Doctor.
Can you hear me now?
Loud and clear.
Yes, can you hear me now?
Loud and clear.
Hello?
Go ahead, Dr. I can hear you loud and clear.
Okay, so good afternoon to you and good afternoon to your audience, your viewers. Thank you for inviting me on this. Where are we with respect to the capacity to manage those who are critically ill? So
Doc, I mean
the capacity as a country.
All right, go ahead, Doc.
Is it okay now?
Yes, we can hear you.
Okay, so as I was saying, our capacity to manage critically ill patients, and for that matter, sub-Saharan Africa, which is known for quite a while, not only with respect to COVID-19, but all critically ill patients or critical diseases are way below what would be desirable. And that has not changed a lot with respect to specialist care. What is changing at the moment is that the number of patients who have contracted the virus and the number of those who are coming in severely and critically ill is steadily increasing. I must say that we in West Africa at the moment, at the beginning of a surge in severe and critical diseases. Irrespective of how sophisticated or how large your critical care capacity is, if the numbers continue to go up, eventually you will be overwhelmed, irrespective of what country. Those numbers in the last couple of weeks are really.
All right, so
and I said this also, yeah.
Doctor, go ahead. You're still on the pulse.
So I say this also because we can actually see what is happening in other places. A COVID-19 wave is similar to what we call the Mexican wave. It always starts somewhere and it flows into other places. So about 3-4 weeks ago, we recognized the fact that there was the beginning of a wave in Africa, obviously driven by new infections, including the Delta variants of COVID-19, of SARS-CoV-2. So we saw in Southern Africa, Central and Eastern Africa, the numbers started going up. And it's catching up with West Africa at the moment. In the last week, our numbers requiring ICU care has more than doubled in the number of our centers. And our daily requirements for transfer to ICU is definitely in a surge at the moment.
Do you mind giving us information on the current status of our ICUs?
All right, so we have a few intensive care units that were repurposed for COVID-19 critical care. And when I say repurposed, it meant that these were previously being used for other activities, either critical care activities as in called the Teaching Hospital and Ridge Hospital, Greater Accra Regional Hospital and UGMC. And then others that were repurposed from non-critical care, as in Ghana East Municipal Hospital, and the new infectious disease center, Ghana Infectious Disease Center, that was built in Ghana East. So for repurposed facilities that were previously doing other things, when the waves go down, what you expect prudently is that they would continue to take care of other patients who may not be COVID-19 or revert back to what they were being used before. For the Ghana Infectious Disease Center, this was purpose-built for the purpose of tackling COVID-19 and other infectious diseases as they come. So yes, the numbers obviously of critical care beds during the decline in cases went down for COVID-19, but would continue to take care of other cases. Now, some of those centers are repurposing back to COVID-19 as we speak, but the ones that are doing COVID-19 actively at the moment, including the Ghana Infectious Disease Center, has a significant number of patients who are severely or critically ill, and the same in Greater Accra Regional Hospital.
We're hearing of shortage of oxygen in some major hospitals. Is that the case?
All right, so that is not surprising. Oxygen ecosystem has always been a difficult one for the health sector in every country. We know as for a fact that the oxygen capacity of basically not only low middle income countries such as ours, but even in other middle income countries and developed countries have been challenged by this pandemic. So it was not adequate previously. We all know that. I mean, so it's not a new thing. But anytime there is a surge, that shortage is going to become even more significant because it is not only COVID-19 patients who are requiring oxygen. There are a lot of other patients, both respiratory disease patients and other critically ill patients, who are requiring oxygen in our hospitals. And until we have an exceptionally high increase in the oxygen ecosystem, this will continue to be challenged. So yes, there are challenges in oxygen supply and requirement that were there. This has been exacerbated by the increasing numbers, but it does not mean that there are no oxygen available for patients. But what we're saying is that as the number of cases go up, as the number of severe and critical requiring oxygen therapy go up, we will eventually get to the point where we may not be able to give enough oxygen to some of these patients. We saw that in India. We are seeing that in South Africa at the moment. We are seeing that in Brazil. We see that even in Europe and countries that are more developed than ours. And that is the fact of it. So it's not something that developed out of the blue.
The Ghana Medical Association says we're losing people at a faster rate. I mean, how worried should we be?
We must be worried. I mean, the pandemic is not over. I'm surprised if anybody in the health sector and for those who decided that at any point in time that we should not worry, because I mean, we are not alone in this. The pandemic is not gone. Anytime there is a surge, we've seen 2 surges already in the first wave last year, and the second wave from December to end of March this year. And we saw what the consequences of that is. So anytime there's going to be a surge, there's going to be lives lost. That is why we have said that it is important to have all strategies on board to make sure that we reduce the spread of the disease and the importation of new variants, as well as making sure that physically and socially we are not gathering to increase the spread. And then, of course, the hand hygiene and the wearing of our masks are very important, as well as the role of our Having said that, a strong point is also what we've been busy doing in trying to increase the critical care capacity in Ghana from January to now, where the National Case Management embarked on training to try to bring in regional teams to Accra to not only give them didactic lectures, but to spend a month with us to try to prepare those centers so that we can have more capacity to tackle this if there was a third wave. So National Case Management for COVID-19 had been busy doing that. But yes, as long as there's a surge, there's definitely going to be lives lost. The numbers are going to increase if the surge increases, as we see in other African countries.
Doc, let's take a look at the nature of cases, and I need you to explain this further for me. What are the nature of cases our facilities have had to deal with?
All right, the most important severity of cases we are having to deal with as case management are the severe and critically ill patients. Now, COVID-19 presents with different severities. There are those who we call mild, who may not have any symptom at all, but they are still able to spread the disease. And those we call moderate, who may have symptoms, but which are not severe enough to require oxygen or to require support of any of their organs. Then, of course, the severe cases who are requiring oxygen, and the critical cases that are requiring not just oxygen, but may require life support, the ventilator, or organ support for specific organs like dialysis, like their blood pressure, their liver, and all that. Now we have to deal with all this. At the moment, majority of those who are mild disease are not hospitalized in acute hospital setting, and therefore it is important that those people isolate themselves, and this must be implemented or enforced, that they do not go about spreading it. Now, for those who are moderate, some of them may need hospitalization, but even more problematic are those who are requiring specialized critical care, of which there are limitations in every country, and more so in Africa. So that is what we are grappling with now, and that is why it's become more topical. Because as we speak now, those number of patients who are requiring oxygen, who are requiring support for specific organs, who are requiring to be put on life support are increasing. In some cases, are doubling in a few days. And if this continues, we obviously will not have enough capacity. And this is totally dispassionate. I mean, if we continue to spread, we continue to have severe, we continue to have people who are critically ill, we will not be able to contain it eventually. And we will start losing people, as we see in Zambia, in Mozambique, in Namibia, in South Africa, in Kenya, at the moment, where they are losing between 50 to 400 people a day from COVID-19 at the moment.
That's quite worrying, Doc, I must say. But we understand also a lot of our facilities are overstretched and understaffed. What can you say about this?
Yeah, because this is an addition to the healthcare load that exists even without COVID-19. We still have accident cases, we still have malaria, we still have both communicable and non-communicable diseases that we have to deal with, in addition to the increasing number of COVID-19. Now, it's basically the same health workers who have to be repurposed or separated to deal with this. But let me tell you why that is even more worrying. I have mentioned to you earlier on that a good number of the patients who will be infected and do have will be mild or be even asymptomatic. Now, some of them may just be in our hospitals because they are requiring just ordinary checkup or coming to visit their relatives. So as long as we have surge in COVID-19, it's not only the fact that we have to deal with this new batch of severe and critical cases. We will have patients in the hospital who may be infected or health workers who may be infected, reducing even further the number of health workers and facilities that are available to deal with both COVID-related and non-COVID-related. We describe this as the collateral damage that comes with this. So as long as there is a surge of severe and fatal disease, there is a surge in number of people who are going to die from those that are not related to COVID-19, but who are also requiring critical care. And that is why it is important that this is dealt with properly.
Now, some time ago, few weeks back, we were worried that people were not complying to the complying with the COVID-19 protocols. Has there been any increase in people observing the COVID protocols?
I will not be much of an authority in speaking to that. I'm stuck in ICUs most of the time, but and that's a major issue. Attitude, disregard of the protocols by the population. It's a major reason why it spreads. COVID-19 spreads by people coming into contact with other people, people gathering, the parties, the funerals, the weddings, and all that. So as long as we continue to do that and these are not enforced, the protocols are not enforced, the numbers are going to go up. So yes, when the numbers went down, people may have thought that, okay, it is gone. But we know that this happens in surges, in waves. When we say it's waves, it means that it will go up, it will come down. And when it's going up, it means that we are vulnerable. It means that our ability to prevent ourselves from being ill or being infected may have gone down. So when we had the peak of the second wave in February, March, and it was going down, most of those who had been infected may have natural immunity, but the natural immunity does not last for long. It's been shown that it lasts for roughly between 2 to 3 months. Now, at the end of March, beginning of April, we knew that majority of those who were infected the first time, if they were not vaccinated, by the end of June and beginning of July, they will not have an immunity to protect them from infection and severe disease. And that is exactly what we're seeing. That's why you're seeing that our waves are happening about 3 months after the end of each wave. That is already known. After the first wave, we didn't know that. We were waiting to see how long that is. But after the second wave, we know this. We have said this publicly multiple times. And I think that this is where the role of the media is also important. That in the middle of waves, when the numbers go down, if we keep shifting our attention totally away, it means that we'll be in trouble until such a time that we have vaccinated the majority of our population. And I'll tell you why vaccination is important. As we speak now, United Kingdom has one of the highest infection rates in the world, registering between 30 to 40,000 new cases every day, only exceeded by probably India and Brazil. But go and look at the number of people dying in United Kingdom. Before, when United Kingdom have even about 10,000 new cases, they were registering deaths running into 1,000 or above 500. But now they are having deaths in single digits or less than 30, if out of over 30,000 people infected. And that's why we say it is important, and we continue to press that vaccination helps. When the vaccination was ongoing, there were a lot of conspiracy theories. But we've seen this, and we have evidence that a lot of the people who got vaccinated may have been protected. Majority of the patients who are coming to ICU now did not have any of the vaccination at all. I would therefore encourage that whenever it becomes available, that the conspiracy theories needs to go away. And I think that the media has a role to aggressively go after that and to make sure that we protect our citizenry by pressing down the need to get people vaccinated. If not, we will have another wave after this wave.
Thing about the kind of variant we're dealing with right now.
Yeah, I mean, from those in the laboratory pillar, they've shown evidence that the Delta variant is already in our community. In our labs in the centers, we have shown evidence that our patients are coming in, and a significant proportion of them have the Delta variant. And I keep saying to people, it does not really matter what variants. Even when we deal with this Delta variant, there will be another variant. As long as we have not broken the circuit of this virus, it will continue to mutate, and it continues to learn what we're doing and will develop its own ability to prevent us from stopping it. We are just lucky that the vaccines that we have on board at the moment are also effective, even for the Delta variant. We may be unlucky if we develop a variant that the vaccines that we have on board are not effective against. But yes, there is significant evidence that the Delta variant is already in the community and is spreading. We know from other places that it spreads faster and it is more contagious and then associated with more severe disease than the earlier variants. But let me say another thing that we should be very wary about. I know during the first and second wave, a lot of young people thought that they basically had bulletproof bodies. It is for the elderly and those who have chronic medical condition. So I can tell you factually now that the Delta variant is affecting equally those who are elderly and have comorbid conditions and those who are young. So we are getting people who are young coming to our ICU and some of them dying. And people need to know this because people have looked at whether vaccinating because they are young is necessary or not. We're saying this now that as we go on, we need to protect ourselves. The young who are going to parties, who are refusing to wear their masks, you are at risk of getting severe disease and critically ill and getting in the ICU from the Delta variant, just as your elderly parents or grandparents.
I'm grateful for your time, Dr. Christian Owo, Senior Lecturer, University of Ghana Medical School. He's Head of ICU at the Kolebu Teaching Hospital and National Case Management Coordinating Member in charge of severe and critical COVID-19.